Hello, and welcome to Neighborhood Health Center Milwaukee, your new primary care clinic. As a reminder, you will not be meeting with a provider today. You will be meeting with one of our clinical staff members. They will go over your health history form with you and get you set up with one of our providers. Typically, we can get you into an appointment with a provider within a day or two. For urgent matters, the clinical staff member will assess if you need to be seen today. Neighborhood Health Center is recognized in the state of Oregon as a patient-centered primary care home. This means that we're here to help you. We try to make you feel at home here at NHC. We build patient-provider relationships and help you make informed decisions rather than telling you what to do. We keep you involved in your care and help you make sometimes difficult and confusing choices about your health. Here at NHC, you will be assigned to a care team. Included in your care team is your primary care provider, a registered nurse, and a medical assistant. You will be assigned to one PCP, and they are your main point of contact here at our office. Our goal is that you get to see that provider for every visit, but sometimes things do come up. If for any reason your PCP is not here in the office, we do not want your care to be put aside. One of our other providers will step in and assist you with your health needs when appropriate. Using the team-based, patient-centered approach, our goal is to give you the quality care that you deserve. Here at NHC, we also offer you access to MyChart. MyChart is an online record system that allows you to look at test results, request prescription refills, schedule or cancel appointments, and you can even send non-urgent messages to your care team. If you have a more urgent need or you would like to speak with someone in the office, please don't hesitate to give us a call. When you do call, we do have some same-day appointments for each provider. These appointments are made on a first-come, first-served basis. You can also speak with a medical assistant or registered nurse for any health concerns that you would like to discuss over the phone. For your convenience, we also have an after-hours answering service. If you have an urgent health concern during non-business hours, please call our main number and leave a message with the answering service for our on-call provider. Typically, the provider can respond to you within 1 to 4 hours. This after-hours answering service is for urgent issues only. Prescription refill and scheduling requests can be done through MyChart or over the phone during normal business hours. If you think you cannot wait and you feel your medical issue is urgent or an emergency, please seek help at your nearest urgent care or emergency room. After any urgent care or emergency room visits, please call our office to schedule a follow-up appointment with your primary care provider. We want to help you prevent any urgent or emergent medical issues from occurring again in the future. If for any reason you need to cancel or reschedule your appointment, please call our office at least 24 hours in advance, or as soon as you know you are unable to make your appointment. If you feel you might be running late to your appointment, just give us a call. This allows other patients to have access to their provider. Included in your privacy packet given to you by our front office staff is our controlled substance policy. Please take a moment to review this policy. Controlled medications will not be prescribed at your first visit with your provider. Controlled medications include any narcotics, depressants, stimulants, or hallucinogens, such as pain medication, ADHD medication, etc. This does not necessarily mean that you will not be prescribed this medication in the future, but you will need to discuss your request with your provider and discuss any of the necessary steps required to be prescribed controlled medications, such as urine drug screens or a mental health assessment. If you are currently taking any medications or will in the future, you will want to contact your pharmacy first to request a refill. Even if you have no refills, you still call the pharmacy. The pharmacy sends a request to your provider and we send it back to the pharmacy. Please submit all refill requests 1 week in advance. This allows providers a chance to review your chart or check in with you if they have any questions about how you're doing on the medication. We do not want you to run out of medication, and we will do our best to make sure that your prescription is refilled in a timely manner. Any new prescription requests require a visit with your PCP. If any blood work or lab work is done during your appointment, your provider will review your results and your results will be available on your MyChart. Or a medical assistant or registered nurse that is part of your care team will call you to discuss your results over the phone. If we are unable to reach you by phone, you will receive a letter in the mail with those results. If you have any questions or concerns about your results, call our office and a medical assistant or registered nurse would be happy to discuss them with you. Here at NHC, we try to address all of your health concerns and needs within our own organization. However, if your provider feels that an outside specialist is necessary, the referral process begins. The referral process can take up to 3 weeks, but don't worry, here at NHC, we have referral coordinators that handle the entire process. We will work with your insurance and with your provider to refer you to the specialist that best fits your needs. Once your referral is processed, you will receive a letter in the mail with all of the necessary information for you to schedule your first appointment. If for any reason you have any questions or concerns about your referral, please give us a call. We're happy to help. Thank you for choosing NHC to be your primary care home. We look forward to being a part of your care team and are committed to helping you be happy, healthy, and well. If you have any additional questions, a clinical staff member will be with you shortly. They will go over your health history form with you and address any questions that you may have. We will then assign you to your primary care team and get you scheduled an appointment with your new provider.